Hey everybody, welcome back to Outcomes Rocket AHIP Insights 2024. We're here in Las Vegas, Nevada at the Wynn with the amazing Don Rucker. He is the Chief Strategy Officer at 1upHealth. So great to have you here, Don.
Yeah, thank you, Saul. Yeah.
So we've been having a lot of discussions, sharing insights from the conference, and we're going to do that today with you. But before, tell us a little bit about you and your background.
Well, I'm a doc who's been interested in data actually since med school in the 70s, working with a guy named John Eisenberg, who eventually went on to head ARC, and interested in the computerization of data since the early 80s.
Wow.
And have been involved, built at a company called Data Medic, built the first Microsoft Windows EMR, was chief medical officer at Siemens, rolled out one of the big widely used computerized physician order entry. Most folks may know me as the former national coordinator where we implemented the Cures Act FHIR APIs and the Bulk FHIR API, which is really important for payers and provider accountability. And now at 1UP, we're putting some of that stuff into action with modern FHIR APIs and modern representations of data that allow you to do a lot of things, but most importantly, they allow you to actually think about clinical data. Because historically, payers have not had clinical data, and so they've had to infer clinical data from the thinnest of trails, which is ICD-10 codes and CPT-4 billing codes. That world is coming to an end. We can talk more about that,
Yeah.
but that world is coming to an end. And so how do you as a payer actually organize your clinical data? You know, it's a totally different data pipeline than the entire claims pipeline that you've built up. How do you do it in a modern, smart way and actually get at the incredible mess that is clinical data, right? Because you have to organize the mess if you're going to use it.
Totally. No, this is super insightful, Don.
Yeah.
So where is the new data coming from?
Well, so the new data is, it's sort of a combination of things. So obviously, with the widespread adoption of electronic medical records, we now actually have sort of, let's call it a source of truth. May not be an absolute source of truth, but let's just call it a source of truth.
Let's call it that.
Just for the point of the podcast.
That's right.
You know, operating on it. And with, the Congress and the Cures Act required these EHRs to have APIs. That's what we implemented in ONC. And so you can get the data as a patient in a real time, your app, but you can also as for your own analytic purposes, or if you're doing an in-network contract with a payer, the payers can get that data through the Bulk FHIR API. So they're getting the core data.
Nice.
And obviously having the modern FHIR data standard enables this to be real. We've been trying to get clinical data for decades and have only been able to do the data that came off machines or really, really simple ADT feeds. But now with the advancement in the rest of the internet economy, JavaScript object notation, JSON, RESTful APIs, right? That's what powers every app on your phone, right? Every app every little icon on your phone is actually talking with some back-end server.
Mm-hmm.
You may not think of it that way. When we press on the apps, we're not thinking there's a back end to it, but we have the, ability now to use that same technology in healthcare.
That's brilliant.
Yeah.
Help us understand 1upHealth and your role in this transfer of data.
So I'm the chief strategy officer, which, honestly is sort of a little bit of a jack of all trades.
Okay.
Somebody who's been involved in building software for decades and practicing medicine for decades. I still practice.
It's a great combination.
And being involved in federal policy. Our goal at 1UP is really to enable the acquisition, which is very tricky. And that's why, somebody would come to us preferentially, is because we've really nailed the acquisition pipeline. And that's a lot of work.
Yeah.
That's sort of, as they say in the IKEA instructions, some assembly required. So building a quality FHIR data pipeline is a lot of work. And then having the data so you can actually compute on it, whether it's classic statistics, modern ML, AI thing, all of those certainly the AI needs regularized data. That's a highly technical term. It sounds sort of generic, but regularization of data is really an important feature if you're going to be modern about it. And you have to have a platform that's real time, that can drive APIs, can drive analytics, can drive behaviors consequently. And that's what we build, and we build it at vast scale.
That's fantastic.
So, it's a venture funded company. We have a whole bunch of A-list investors.
Well,
so that's what we do.
That's brilliant. Appreciate you sharing the what and the how.
Yeah.
Not a lot of people were able to make it to the meeting.
Yeah.
And part of the point of our podcast today is to share insights from the conference.
Yeah.
What's risen to the top from the panel that you were on to other sessions you may have attended?
Well, there was just a session that closed with David Brailer from Cigna on re-architecting healthcare, right? And moving it from a B to B to C, if you will, sort of the classic payer to, the employers purchasing, a planned service to consumer. And if we're going to get consumers involved, and that really is the mandate that's coming, right? That's the essence of Medicare Advantage. That's the essence of managed Medicaid. It's increasingly the essence of a lot of commercial plans. Those are all data science things, first and foremost. You can't just add something as a bolt-on to your claims pipeline and think you're going to be good at it or adequate at it. And I think that's the takeaway. Now, there's a lot of confusion here. People, a lot of sort of point solutions and, fixes without understanding that computer science can actually do a lot of this vastly better than maybe alternative approaches, let's say.
Yeah.
But, that's life.
It is. No, appreciate you sharing that. The re-architecting of the industry is something that we should all be thinking about, our approaches to it. Just according to Don and the work that he and the team at 1upHealth are doing, there's huge opportunities, and the technology and the partners exist today. Don, final question for you, and then we'll wrap.
Okay.
What call to action would you leave our viewers and listeners with?
Yeah, I think the call to action is really to think about, how am I going to change my processes? Let's assume you're in that sort of provider-payer pipeline, for argument's sake. How am I going to change processes so I can efficiently use clinical data, which all kinds of computing on it, whether that's quality measurement, whether it's network design, whether it's prior authorization, whether it's case management, whether it's more directed payer-to-patient outreach. How can I do that with the same data stores and really start thinking about getting care earlier and more efficiently? Because that's where policy and economics are driving you. It is now, finally, I've been in the space for decades. It is finally doable. So it's a very exciting time, right? After all of these years, to sort of see it finally be doable. So I think that's the claim to action to folks. Obviously, from a purely commercial point of view, we're happy to help you at 1UP and at least have a conversation, and folks can decide.
That's fantastic.
Yeah.
Well, you not only waited, you acted persistently since your college days.
Yeah, med school days,
all the way until now.
So
it's real.
Yeah, 1978.
So now that it's real, let's get to work.
Yeah, exactly. Yeah. Glad it's there while I'm still kicking. Truth be told, there was some decades I was wondering. I thought when I graduated from business school in computer science, I did a roll-your-own program after residency.
Amazing.
Which I sort of finished all of that in 88. And I foolishly thought the EMR problem was going to be solved in 3 years. And, it's still a little unfortunate. Their EMRs essentially effectively prevent automation as opposed to facilitating it. But, they've responded to the policies we as policymakers have given them, so you can't blame them.
Yeah.
But
sure.
The world's changing.
It has, and the opportunities are here for all of us. Don, I want to thank you for joining us on our podcast today.
Thank you, Saul. Appreciate it.
It's been a real treat and a pleasure to have you. And for everybody listening and watching, thanks for tuning in. Let's take action on the work that Don has shared with us today. In the show notes, you'll see ways to get in touch with Don, to get in touch with 1upHealth, and stay tuned for more insights from AHIP 2024. Thanks, Don.
Thanks.